Hey there, everybody. Dr. Tassone here, just kind of talking on a Sunday. It's Endometriosis Awareness Month, and so wanted to just kind of sit down for a minute and see if anybody had any questions. I'm just going to talk about endo really quick. Endo is that, what would I call it, that silent crusher of souls, in the sense that it can really be something that affects a woman's life and she doesn't even know she has it, because a lot of doctors just don't diagnose it. Many women will go on average 7 years with pelvic pain and really not know what they're dealing with. Does that little bulb on the top of my head make it look like I have like a halo? Anyhow, what happens is we don't know exactly what causes endo. And you might hear some of these weekend warriors out there talking that they know exactly what endo comes from and what causes it, and they don't, because nobody does. There are some theories floating around out there, like what's called retrograde menstruation, where instead of anterograde menstruation, where you bleed out the vagina, the blood goes back through your fallopian tubes and can implant inside the pelvis, because there's cells in that blood. And that makes sense, because the number one site for endometriosis is the ovary, which is the first place that the blood would come out the tube. Thanks, Nat, I know. The second type of theory is that it's immune, or that it's congenital, in that we have these little implants. Women have them when they're born. There are people out there saying that endometriosis is not a hormonal imbalance issue, and I would say, you're wrong. Thank you. It is a hormonal imbalance issue. It may not necessarily be caused by hormone imbalance, but a hormone imbalance is going to make it worse, and your hormones not being balanced is going to be something that's a problem. So that being said, also, if it is retrograde menstruation, where the blood flow is backing up through your fallopian tubes, then that's totally related to your hormones. What happens is there's some people out there saying that it's an immune disease. It's not necessarily an immune disease in and of itself. Now, endometriosis will cause your immune system to attack those implants that are in your pelvis, and occasionally your immune system will get overwhelmed because of their response. So that can be an autoimmune disorder in and of itself. So some of us tend to think of endometriosis as an autoimmune disease, and it's definitely inflammatory, and it's definitely something that can be related to the way that you eat, your weight, your hormones. It can be a lot of things. So let's talk about two other things. One is adenomyosis, which is if endometriosis are the little implants inside the pelvis, outside of the uterus. Adenomyosis are those little implants, but inside the muscle wall of the uterus, growing like roots. Women that have adenomyosis will often complain of very heavy, painful periods, for years and years and years. The problem with adenomyosis is that it has to be diagnosed under a microscope, which means you can't have your uterus in your body. So it's actually a diagnosis that's made on pathology after a hysterectomy. There is something called endosalpingiosis that I never hear the self-proclaimed experts talking about. So if you're one of those experts out there that has not actually seen endometriosis because you've never done a surgery or taken care of a patient that has bad endometriosis, listen up. There's another disorder called endosalpingiosis. And endosalpingiosis is in that same genre, although the cells, instead of coming from the uterus, are actually coming from the fallopian tube. And the problem with that's why we think in medicine that maybe it's this retrograde menstruation, where the blood is going back out the fallopian tube into the pelvis instead of out of the vagina, because there are also fallopian tube cells that can get outside of the pelvis or the uterus and tube and get into the pelvis and implant on the uterus, the ovaries, all over the place. So as it stands right now, endometriosis is only guaranteed, the diagnosis is made at the time of surgery. You have to see it, and technically you should have a biopsy of it. Otherwise, it's pure speculation, which is fine. The problem is most women on average wait longer for a pain diagnosis than men do. We know this from studies recently that show women suffer 16 minutes longer in an emergency room before they get pain relief than men. And many, many women that have endometriosis get blown off. They are told, oh, you're just getting older. If they're younger, they're saying, oh, this is just normal. It's normal for your age. And they may go, on average, 7 years before they even get the diagnosis. Robin, did you check for that after you do removals? When I'm in there doing Isha removals or hysterectomies, yeah, you're looking right at the pelvis. So if there's endometriosis there, then we remove it. The other thing that I was going to say is that the time of diagnosis is during surgery. However, you can suspect it. Now, there are different stages of endometriosis, 1 to 4, with 1 being a few implants, 4 being fulminant endometriosis, distant metastases in the sense that it's in the lung or the brain, skin. I've seen it in weird, weird places. The amount of endometriosis you have doesn't correlate to the amount of pain you have. So a stage 1 patient could have horrible, horrible pain, and a stage 4 might have none. But usually women that are advanced, that are having severe pain, even though I'm integrative and I like to look at a lot of other things, sometimes surgery has a place because it has to be physically removed. Now, I'm not saying that's the first step, but it is a step in the process. So on average, women are put on what first? Birth control pills. Well, birth control pills aren't going to necessarily help endometriosis, and actually, in my opinion, they could make it worse because you're taking endometrial cells which are responsive to estrogen, and you're hammering them with more estrogen. Now, we know that endo can sometimes improve in women that are pregnant. That could be a lot of reasons. That could be because of the high levels of progesterone that are floating around in her body. It could also be that the immune system is actually suppressed in pregnancy, which could make the inflammation better as well because the white blood cells aren't necessarily responding as much. So, Trina, what causes an endometrioma? Endometrioma is just endometriosis that gets on the ovary and causes a cyst. And how do you get one outside of the pelvic cavity? Well, in the theory of retrograde menstruation, the blood that goes in your pelvis back out your fallopian tubes as you lay down is going to roll up into the pelvic gutters. It could move up into different areas. There's also a theory that it could get spread through surgical interventions like C-sections and things like that, because I've seen endometriosis in a C-section wound. I've seen endometriosis actually after a vaginal delivery in a woman that had stitches in the vagina because she had a tear. A couple of years later, she actually had endometriosis inside the suture line. So it's just a hard knot, and basically had to be excised because it wasn't going to go away. It didn't matter what we did. So it can spread through, we think it can spread through the the lymphatic system. It can spread through the bloodstream, we think. And that's why it gets into distant tissues like lungs and things like that. So I'm a personal fan. I'm going to turn off my dishwasher as it's beeping. I'm a fan of, obviously, getting to the root cause. The problem is we don't know exactly what the root cause is. Now, we can assume that it's hormonal, immune, spread surgically, whatever the cause is. We want to treat the inflammation, and we want to look at things that make inflammation worse. So you want to start, and I always think this way. I have Maddie, if she is on here, just made me an infographic. It's kind of like the food pyramid, only it's how I think we treat hormonal imbalances. And the same could go for endometriosis, in the sense that I think the first step should be nutrition. In hormonal imbalance, I think just in general, getting rid of foods that are inflammatory, and that could involve, gluten, dairy for sure. But what are you really inflamed by? And I don't mean your spouse or your partner. That would be incensed, not necessarily inflamed. But what causes inflammation in your body? And that could be what's causing more pain. So what I'd like to say is we should probably look at nutrition as a base treatment for this, and then look at other things like hormonal modulation, If your progesterone is low or you're estrogen dominant and we need to bring your estrogen levels down, we can look at supplements like D-glucarate or DIM, depending on which way you're pushing your estrogen metabolites. And then even looking at things like exercise. I mean, obviously, we want to treat, if you are overweight, which is causing some estrogen dominance, we could improve the symptoms of endometriosis all the way to supplementation. Supplements at certain points probably aren't going to do a ton unless we're supplementing with like a low dose progesterone that you can get from certain companies that are over the counter. Once endometriosis has set up shop, you can look at the anti-inflammatory supplements like Zyflamend, which contains holy basil and rosemary, and turmeric or curcumin to really help with inflammation, along with diet can definitely make a difference. You could even look at things like acupuncture, massage therapy, physical therapy, things that are going to work not just on the physical but also the emotional and the spiritual or energetic levels, and even look at something like we talked a little bit about spirituality, but for some people that means different things. Do you do anything to help with pain control? Meditate, yoga, things like that. There's two other things that I think can help. One is CBD oil. I'm a big fan of CBD oil. I think that it's really fascinating to me that we have cannabidiol receptors in our bodies, and yet we don't just readily eat or consume cannabinoids. So why do we have those receptors in our body? Why did we evolve to have cannabidiol receptors in our body that can cut down on pain and inflammation? We may never know that, but I think it's fascinating. So CBD oil is great for inflammation. It's great for pain control. It's not addictive. It has no THC in it. And I think it's a good adjunct for things like that. So the other thing is low-dose naltrexone now is coming to the forefront as a medication that not only helps with inflammation and autoimmune disorders, but can help with pain simply because it causes your body to make more of its own endogenous endorphins. Those are the things that give you the runner's high, that help with pain. Endorphins, your body can make tons of those. And low-dose naltrexone, it appears, which is a prescriptive that you have to see a physician for, can help with that, can help with the inflammation, can help with other things. Maddie just joined. Maddie can put up the phone number to the office. That will, if you want to come in, if you think you might have endometriosis, if you have had surgery for endometriosis and would like to know your options. I just did a case last week where we're simply not just burning the lesions, we're actually cutting them out, because what we have found is that some of those lesions can go much deeper than we thought, and you can't quite possibly burn all the way. So we actually have to excise those lesions now. And women are doing a lot better with that procedure. So it's not all lost. Endo inside the belly can cause lots of scar tissue. It can cause infertility because it can mess with the motility of the fallopian tubes, because not just of the direct damage from the inflammation, but sometimes that the actual the inflammatory portion of that, even if it's not on the tube, there's little hairs inside those tubes that move, that bring the egg, causes a current and brings the egg down the tube into the area of the uterus, so it can get fertilized. If that current isn't working because you have a situation where the cilia are damaged from the inflammation, then using anti-inflammatories and getting rid of that endometriosis is good, because it can cause infertility. Erica just joined. Erica is my nurse practitioner student who is wonderful, and she's learning from the best, obviously. But no, she's great, and obviously learning about endometriosis. So if anybody's out there that has questions, throw them out. It's Endometriosis Awareness Month, so we need to be talking about this. We need to talk about why women aren't getting diagnosed, why they're getting put on birth control pills, why women suffer longer with pain than men. and why, on average, women with endo are waiting on an average of about 7 years before they get the diagnosis. And these are girls that are in high school that are missing, classes, they're missing athletic events because they simply can't function. And those women usually have increase in pain around the 7 or 6 days prior to the start of the period. What happens is, I liken it to this. If you were to come into my office and for 5 days out of the month, and every day I punched you in the face, that's endometriosis. However, well, let's say I didn't punch you in the face. I punched you in the arm for 5 days. Eventually, over years, that arm is just always going to be sore. But when you were being punched, it would be exquisitely worse. So that's what endometriosis does to the body, does to the uterus, does to everywhere it touches, is that it hurts like hell when you're having the period or right before the period. But over time, that area is just so sore and so inflamed and so bothered that it can just hurt constantly. So guys that, the problem with women's anatomy is that most of it's on the inside. We can't see it. We just look at them and we think they look the same, that they look pretty, but they are just in horrible amounts of pain, and we kind of blow them off as spouses, as partners, and obviously as physicians. And so we need to be better about that. We need to talk about it. We need to be willing to diagnose it more. We need to be willing to treat it better. And that can be on any happenstance. But what I don't want to happen is for women to get bogged down in all of this stuff that's out there, and I could call it BS, but I watch a lot of the posts that go up on Instagram, and a lot of it is sensationalistic. A lot of it is one little study that they turn into this big production because it supports the scare tactics that they're using, or the fear-mongering that they use to make themselves look like experts. Look, basically, in a nutshell, endometriosis sucks. Endo sucks. Let's say it again. Endo sucks. And sometimes there just isn't a whole lot you can do conservatively to fix it. We can definitely try those things. Most women that have been suffering for a long time, maybe they don't want to do anything, or maybe they want to just have surgery to fix it right away. Everybody's in a different place. Every woman is in a different place when they come in. And so there shouldn't be any judgment. It's all about fixing. It's all about helping. It's all about taking care. And so I think that's what we should learn this month, is that endometriosis sucks. It's not talked about. It's the silent crusher of souls, and men need to be better about taking care of it as well, because sometimes it's good to just take care of somebody else when they're hurting. If there's no questions, I may finish up, so I'll just stay on for another second or two. Maddie's on. If you're on, you can post the phone number to the office, 512-956-0296. Also, I was telling them, Maddie, about the food pyramid on how to fix your hormones and things like endometriosis, and we'll be posting that soon. We're going to be coming out with some classes online to help you balance your hormones, so all that's going to be in there. And I just want to put a plug in for a new hormone mastery series that's coming up, where I will have 15 experts in the month of May. It's Women's Health Awareness Month. There's going to be one expert per day. Nat Kringoudis and I are going to be interviewing these people on video chat. It's kind of like karaoke and comedians in cars without the car, and literally with no breaks, because I'm calling BS on a lot of these treatments that we do to women. I'm calling a lot of BS out on a lot of these experts that are out there putting in pellets and not knowing what the hell they're doing and injuring people, and women not being taken care of. So we're going to cover things from hormone imbalances to polycystic ovarian syndrome, birth control pills, red light therapy, spiritual practices and meditation, exercise, nutrition, all geared around women's health and especially hormone imbalances. And it's going to be one person a day rather than these other, master series or summits that you see online where there's 6 or 7 people a day and you can't focus. We're doing one expert a day. We're talking about them every day. We're going to talk about the topic that they talk about all day, and we're going to really spotlight these experts. This is not just somebody that does dabble. These people that we're interviewing are serious experts in their fields, and they wouldn't have been invited if they just didn't know what they were doing. Christine, if I have suspected stage 4 endo with bowel strictures, is there anything non-surgical that I can decrease the scar tissue? That would be debatable, but the doctor in me says probably not. I think if it's gotten to the point where there's physical scar tissue, short of maybe going to a physical therapist if they can reach it, to break it up maybe physically, but I can't imagine that would feel very good. I think if it's that bad that you may consider other options if you want it fixed. And like we said, I mean, it's hard to say it's stage 4 if you haven't really seen it, unless you've had surgery in the past and they have seen it. But definitely would be something that I would see a doctor about, and somebody needs to do an exam. You could get something like an MRI of the pelvis or a CAT scan, not that those see endo, but they could maybe look for why the colon is having that stricture issue. That's a little concerning, and something I would definitely talk to a doctor about. What else? Anything else out there? You can always ask questions afterwards. If it's not live, we'll still come around and answer them. Other than that, I think I'll sign off for now, and we'll talk about endo the rest of the month.